Hey, everybody. I think we are going live on Facebook, but my Zoom link is not going live, Jessica. So I'm just giving that a second. I have with me today Dr. Jessica Drummond, who is a women's health expert, a pelvic health expert. And I asked her to come on and thank her for being on because I have gotten lots of questions over the years about hysterectomy and basically how do I balance my hormones if I've had a hysterectomy? Because I talk a lot about balancing hormones, but that's not an area of my expertise. So thank you, Jessica, for coming on. I really appreciate it.
Thank you so much for having me. It's my pleasure.
Well, let's just dig right in. Let's just talk about that question. So some women are getting just their uterus removed and then they still have their ovaries. Some women are getting it all removed. Maybe start with the difference in aftercare and hormone balance in those two scenarios.
Yeah, so if you have had a hysterectomy, especially if it was in the recent past, don't forget that your hormone system also involves your adrenal health, your thyroid health, your insulin balance, your blood sugar balance. It's not only about your sex hormones, your estrogen, progesterone, and testosterone. So if you've had a hysterectomy where your ovaries were preserved, then you also, at least for a while, generally have the functioning of your ovaries. Now, they will tend to slowly stop functioning over time. So, you may have a sort of natural
Just with
early
aging, is that
menopause.
what you mean?
Well,
Or
no, I mean, because of the surgery. So let's say you have a hysterectomy at 35, but if you hadn't, you may have gone into the average age of menopause is around 51, 52. So let's say you have a hysterectomy at 35. It's pretty rare for your ovaries to maintain robust function all the way to your 50s. They might maintain robust function for 4, 5, 6, 7 years, something like that. But they're not likely to continue to secrete hormones at the same level. Does that make sense?
okay, and that's just something about having a partial hysterectomy disrupts the communication or something. Why does that
I'm
happen?
not really sure what the mechanism is, but it's a pretty clear result. It's a
Okay,
common result.
interesting. I did not know that. Okay.
So if you have had your ovaries removed from the beginning, or you had your uterus removed and you preserved your ovaries, but it's been 5, 6, 7, 8 years, it would be not uncommon for your ovaries to be declining in function. And so, as early as possible, ideally prior to your hysterectomy, but we can't go back now. So, if you've already had your hysterectomy, you want to be optimizing the health of what's called your hypothalamic pituitary adrenal axis. So, your adrenal glands post-menopausally secrete the vast majority of your estrogen. And there's some variability, and it depends on different things like abdominal adiposity and stuff like that. But you want basically your hypothalamic pituitary adrenal axis. What that is your stress resilience system. And there are a couple of key things that keep that functioning really well. Number one is keeping your blood sugar balanced. So for most women, that involves eating a lot less or almost no sugar, because when you eat sugar, you have a more hyper responsive insulin response, which then can over time trigger your adrenals to kind of buffer that stress with elevating your stress hormone level. So eating a blood sugar balancing diet, and I like to start with just a really nourishing, protein heavy, maybe fiber, some fat in the morning. So, in America, we kind of think about having like breakfast for dinner, like waffles for dinner. Instead, if you really want to optimize your blood sugar, start your morning with dinner for breakfast. So like leftover soups and stews, omelets, something that's got protein, fiber, primarily in the form of vegetables, and healthy fat. So
Okay.
that's a
I
good
like
way
that.
to kind of start balancing the hormones. Another thing that works really well is really focusing on our sleep and circadian rhythms. So getting to bed by about 9:30, really shutting off exposure to these computer lights and phone lights and Kindles and laptops, and just reading quietly, taking a warm bath. At night, you can wear these glasses that have amber colored lenses to help block out the blue light that just might be coming in from various sources. And getting to bed, ideally asleep by 10 p.m., because between 10 p.m. and 2 a.m. is a great time for recovery of that stress system. And then getting up in the morning, and as soon as you wake up, getting outside for some daylight exposure without sunglasses, because getting those rhythms trained is very helpful for how the brain helps to modulate hormones. And then, ultimately postmenopausally, it's not a bad idea. And I recommend it in a lot of cases with nutrition, sleep regulation, making sure your digestion is healthy. There are a lot of conservative measures we can take, but younger bioidentical hormone replacement therapy, having an assessment by a physician who is skilled in bioidentical hormone replacement, doing that earlier rather than later is safer for your longer term cardiovascular health.
Okay. I remember that from what's his name? Mache.
Mace.
Mace, there you go. Yeah. He taught me that and I kind of forgot about that. So yeah, adding the hormone replacement like postmenopausally is riskier, right, than adding it earlier?
Well, not necessarily postmenopausally, but later. Okay. Later, the longer you wait postmenopausally. So if you have your hysterectomy at 47 and kind of conservatively, you're not able to get your, feeling asymptomatic and healthy and energetic and all of that, good libido by the time you're 50, I would want a consult. I wouldn't wait till you're 57, 60.
Okay.
And even better, if you're considering having a hysterectomy right now, first give yourself 6 to 12 months to really optimize and make your stress resilience system very robust. Totally get rid of the sugar, anti-inflammatory diet, blood sugar balancing, great sleep, possibly less intense exercise, but more consistent. So a walking program, but really consistently, aquatic exercise. Strength training is great for optimizing resilience. So about 2 to 3 times a week of a relatively heavyweight strength training program. So doing that in advance is ideal, or as quickly as possible post-hysterectomy, especially if your ovaries have been preserved, so that you've got the support of your ovaries while you're strengthening the other aspects of your hormone system.
I like all that. Okay, that's interesting. So we've talked about some aspects to keep hormones balanced, and you're a specialist at pelvic pain and pelvic disorders. I know I had one client who was pretty young and got a hysterectomy and ended up having a lot of pain and water retention, and she had to get all this physical therapy. So I wonder how common some extent of discomfort is after hysterectomy.
Well, here's the challenge. A lot of physicians still do hysterectomy to relieve pelvic pain. And that's really not very effective. At best, it's about 50-50 effective. And there's not really a good way to tell who the 50% are. So I think it's a very, very much a last resort strategy for pelvic pain.
May I ask a question about that? So pelvic pain, would that include endometriosis, fibroid? I mean, I think fibroids and heavy bleeding is probably the number one thing I hear people got a hysterectomy for. Is it sometimes just unknown? Like, I'm just uncomfortable.
Yes. I mean, it could be related to PCOS. It can be related to pelvic floor dysfunction. It can be related to bladder pain syndrome. It can be more sexual pain like vulvar pain. It can be, sort of idiopathic, and we don't really have a mechanism. It's the most common cause of pelvic pain is endometriosis. But hysterectomy does not cure endometriosis. If you learn nothing else from this little conversation, you cannot treat endometriosis with a hysterectomy. Because here's the problem. Endometriosis is a growth, kind of a benign tumor-like growth of endometrial-like tissue, not exactly endometrial tissue, outside of the uterus. So taking out the uterus does not solve the problem. Now, adenomyosis is growths, those benign growths of endometrial-like tissue in the muscular lining of the uterus. So a hysterectomy can be curative for adenomyosis. And unfortunately, in the case, well, endometriosis can really only be truly diagnosed by laparoscopic surgery. We don't have good imaging or biomarkers or things like that for endometriosis yet. And in some cases, women have both endometriosis and adenomyosis. So it gets a little complicated, but before just saying, I have this intense pelvic pain because of my endometriosis, having a hysterectomy is not the best first choice. Now, it is possible that you have endometriosis and adenomyosis, and then having a hysterectomy is potentially quite appropriate. But there are many things you can do first. One, nutrition, pelvic pain modulating nutrition, endometriosis improving nutrition. There's a lot of strategies we can use to help support the immune issues associated with endometriosis, to support the inflammatory issues. So there's a lot we can do with nutrition. Second, and collaboratively really, would be pelvic floor physical therapy. And because I'm a pelvic floor physical therapist, I always carry around a pelvic model. So I don't always, but this happened to be right here. So here's your pelvis, right? And then if this woman was lying down, here's the vulva, the external anal sphincter. And so see all these muscles, all this red here is muscle, right? So these muscles, and you can see kind of from the inside of the pelvic bowl, lots of muscles, and they connect to the hip on the side here, and inside we connect to the hip. And it also connects to the spine. Here's the sacrum. So you can have a lot of pain referred to the pelvic region, the lumbar spine, the hips, from the musculature of the pelvic floor. So again, having hysterectomy is not going to improve this situation. And don't forget, there's vessels and nerves coming from the spinal cord area, right? And through the hip and through all these little, spaces here. And so you can have nerve issues, you can have circulation issues, you can have muscle tightness issues. And so whether you decide to have a hysterectomy or not, doing a lot of manual work and kind of learning some pain science and relaxation, mindfulness work, some specific exercises for the pelvic floor, stretching of the muscles of the pelvic floor, manual therapy of the pelvic floor can really help relieve the pain symptoms, whether it's before or after your hysterectomy. And the same thing kind of with the patient you were describing. And if you do that at the same time that you're eating an autoimmune considering and an anti-inflammatory food plan, getting a lot of hydration, getting good sleep, keeping resilience in your stress buffering system, which helps to modulate and balance the hormones, then you're really taking a far more comprehensive approach to optimizing the outcome, either allowing you to avoid surgery, or if you've already had the surgery, to have the best outcome post-surgically.
Mm-hmm. Yeah, that's really good advice. That's really good advice. I'm kind of getting the sense, Jessica, as we talk about this, that some of these symptoms, they're pretty shitty. They're pretty bad. I don't know why that came out of my mouth. But it sucks to be in like extreme pain every month with your period, or have these super heavy periods and you're like using 10 tampons a day. And I think you just get exasperated. But what I'm also hearing is, whether you've had a hysterectomy already or not, those basic things about, blood sugar, nutrition, physical work, getting to bed on time, they do matter. They matter for things like pain and inflammatory response. So those things are still foundational. I liked your tip about looking into bioidenticals earlier. A lot of women probably haven't had pelvic floor work, and I've had some. I just get this stuff out of curiosity. I'm like, oh, that sounds it. I've had Mercier method. I've had, what's the other one called? What's Tammy Kent's one? Holistic pelvis.
Oh, yeah. Her book happens to be right here too. Tammy
Yeah.
this is
I've had work from, that's a great treatment. Really can work for all sorts of things, I think. I just did it because I'm just a nerd, but I think you could probably do it for, painful sex, sexual trauma, any number of things, fertility.
Yes, there are many ways that pelvic floor physical therapy helps a lot. Pain is one of the top ones. Incontinence, sexual health.
That's a big one. Yeah. Okay.
And just being able, one of the things I said is really restorative for hormone balance, especially as women get into their 40s, especially when we start having blood sugar impacts of the perimenopausal hormonal shifts, is strength training. Strength training more and more, I think we're going to be finding that the data is going to show us some benefit to immune health, to endocrine health, because the skeletal muscles are not, they have biochemical components as well that we haven't really explored very much yet. And so, heavier strength training as more and more women do straight weightlifting or CrossFit. It doesn't have to be highly intense. I don't always recommend that, especially depending on how depleted you already are. But lifting at a weight that's heavy for you at a relatively low reps, a few times a week, even 10 minutes a week, women who can get up out of a chair without pushing off, just start practicing, just standing up, just getting off the floor, doing lifting
squats and
doing squats, like strength of the hips and the legs and the low back is so important to our long-term function, but it's also really important to our immune health and our endocrine health. And so where I'm going with this is that when you are struggling with pain and you're struggling with hormonal imbalances, don't forget that you've got all these tools to really optimize the treatment. You don't really want to go when you have pain. It's not an ideal strategy to kind of go from clinician to clinician to clinician or practitioner to look for the magic pain relief button, right? The healing magic wand. This is what women do a lot of times, or, and it's not your fault. This is how you've been trained by the medical system. But the training is just like, well, if we can't fix it, we just take it out. And the problem with hysterectomy, when you do that without shoring up the system, the endocrine system, the digestive system, the blood sugar balance, all of these factors, then you have those side effects, those kind of secondary recovery issues. So whether you've had the surgery or not, think about a holistic program to really optimize the outcomes of those surgeries, or potentially not need them at all. And I think for women's surgeries in particular, this is really important. Like, they would never send like a pro male baseball player to shoulder surgery without a whole like rehab, nutrition program around it, right? Unless it was like an emergency, like, but, and even then it would be post-surgical rehab. But, we have C-sections, hysterectomies with no rehab at all, no nutrition support at all. And, sometimes they send you home with an infant, right? And so,
I remember that this is reminding me a bit of the fertility situation too, because like my body was not shored up properly for my own pregnancy. And then, after pregnancy, it's like they pay attention to you while you're pregnant. And then afterwards they're like, well, how's the baby? Is the baby gaining weight? And I'm like, what about me? I got hot flashes. I got all this stuff going on. So this is kind of a similar life event that you're facing, whether we're just talking about facing menopause, which is a big life event, or choosing a hysterectomy or recovering after a hysterectomy. Yeah, that's a great point to really shore up the systems. I like that a lot.
And, surgical menopause is so abrupt for many women that it's really, and it can happen really young. I mean, what if you have ovarian cancer or something like that, right? In that case, hysterectomy is life-saving. But what if you have ovarian cancer at 26, then you want to shore up that system as quickly as possible. And I think no matter how old you are, consider the benefits of hysterectomy if you do have something like cancer, or if you've tried everything else for your fibroids. Fibroids can really be affected nutritionally, but sometimes they're pretty resistant. There are appropriate times for having hysterectomy, but I think my most important point here is that, like any other surgery, we want to make sure we're really helping ourselves and our clients optimize the system so that the outcome of the surgery will be the best possible thing, that you're not just knocked down by the surgery itself.
Yeah. And I think, even our audience is pretty into natural stuff. You can kind of be tempted by that shiny apple of, well, when I have the surgery, everything will be better. And it won't necessarily be better, because you still have blood sugar issues and you still, have this and that to be addressed. So yeah, I know you said it will be great if we can get on and prevent preventable hysterectomy. Your practitioners many of them are physical therapists, right? And then they're often also women's health coaches you train. Tell me the full name of your program again.
The institute is called the Integrative Women's Health Institute, and
Okay.
we have the Women's Health Coach certification and a lot of other continuing education programs for professionals.
Okay.
And we do have 3 programs for the general public. So we do have a kind of do-it-yourself pelvic pain recovery program, but ideally, while that's good, that's a good place to start. Anyone struggling with pretty intense pelvic pain, I really recommend that you do work collaboratively with a practitioner.
Okay. Yeah, I think that's too. It's just good to have that support network. But they're going to physically help you, but just as good to have that support. So we put a link in the Facebook Live to a free ebook you're offering about pelvic pain, all sorts of pelvic pain. Somebody said the link wasn't working, but I did check it and it's working. So I just reposted it. So maybe use my reposted link. Do you want to tell us just a little bit more about it? And if someone's watching and they are a practitioner and interested in more training, a little bit for them too?
Sure. So if you yourself are struggling with pelvic pain, the first thing I would do would be to read the book. I kind of mapped out the step-by-step system for, all of that collaborative work for optimizing the system so that your pelvic pain will be relieved. And it's a book that's designed for patients and for practitioners. It helps to facilitate the conversation and the collaboration, because there isn't that magic wand. As a patient, you want to kind of show up really empowered. And as a professional, you want to be able to work with your client in an empowered way for you and them. So it's a book for everyone. And then for our training programs, the Women's Health Coach certification is a big deep dive into optimizing all of those systems from a nutrition standpoint, and then collaborating in a coaching model with your clients to really help them make the behavior changes. Because, while I wish I could just eat for everyone, ultimately, if it's your body you're trying to heal, you've got to choose what to put in your mouth. You've got to choose when to go to bed. And that takes some work in collaboration with your practitioner, because there's a lot of behavior change that goes along with that.
Yeah, I'm just remembering that's one thing you've talked about before that I really appreciate. And it's so true. Even some people who are watching and they're like, I have a lot of healthy habits. We all have our little areas where we don't want to make a change and we don't want anyone to tell us otherwise. And just having that conversation and, hearing it in a different way, hearing it in a different setting. For me, like I always say, education is what does it for me. That's the thing that will really drive me to make change. Whereas for other people, it might be a different motivator or practical tools that I think you've talked to me about before. Okay, how do I start going to bed earlier? That might just boggle someone's mind,
Yeah. And I mean, it's not always easy, right? What if you have 3 teenagers and you've got a carpool and,
and they're up late and and it's your only alone time. I know we both heard that one a lot. And just physically, your body is used to going to bed at midnight. So
Yeah.
it takes the role back. So yeah, well, and people can get together with your coaches. I put the ebook on here, but I will also put a general link to your site, Jessica. Any last comments you want to make before we close up?
No, I just think the thing to remember is that a hysterectomy can be a very valuable surgery, just like every other surgery that we have in modern medicine. There's some real value, but if you're deciding whether or not to have a hysterectomy, don't think of it as this magic bullet solution. Think of it as part of a comprehensive plan where you'll be making health behavior changes to improve your overall health. And in that context, and when you think of it that way, sometimes you don't need the hysterectomy. And if you do, your outcome will be a lot better because you're just going to be in better overall health.
Yeah. Okay. I love it. I love it. And I got your link in here. Yeah. I think the first time I posted it didn't work for some reason. Yeah. Thanks to everyone who's watching live. Anybody who watches later, just feel free to ask questions. And if it's too hard for me, I'll ask Jessica to come back and comment, because we definitely want you to feel supported. I think that women probably feel quite unsupported if they've gone through a hysterectomy and things still aren't going well. And, maybe the doctor who recommended it now doesn't have another solution for them. But I want people to know there definitely are other solutions and other practitioners who can help you, including Jessica's trainees. Thanks again, Jessica.
All right. Thanks for having me, Bridgit.